My name is Shalva Eliava, and I just finished my 3 year of residency here at Ingle Hospital, just like last week, and then started my chief year, which is my last year. My interests are in gastroenterology, so I hope to be a gastroenterologist at some time in my life. So I was very happy to come here and then give you the talk about gut health. And thanks everyone for being here. The gut health is kind of like pretty broad topic and then complex. So I kind of try to, build the presentation based on what would be the interest of the community. If you guys have any questions, you can always stop me anytime and then ask the question, okay? So it's gonna be like a brief review, and hopefully you will learn something new about the gut health. Do you guys all hear what I'm saying? Is it good? Okay. So what are the objectives for today? We're going to learn today the foundation of the gut health, the role of fiber in the food choices, what are the pro and the prebiotics, and the gut health linked to belly fat and bloating. So what is the gut health? So gut health refers to the balance and the proper function of the entire digestive system. So digestive system starts from the mouth, and then we have an esophagus, which is a tube that connects the mouth to the stomach. And then we have a stomach, then comes the small bowel, which has different parts. Then we have a large bowel, which also has different parts. Besides this long tube that we have in a digestive tract, we also have some of the organs that are crucial for the digestion, like liver, which is located in the right side of the belly. And we have a gallbladder, which is sitting right below the liver. And then we have a pancreas, which is kind of in the middle, below the stomach, and all these organs are crucial for the digestion. And except that, we also have a gut microbiome, which is trillions of bacteria and microorganisms living mostly in the large bowel, and these are what we call the good bacteria. So they help us to function, and they help us to balance the gut health. So what are the signs of the healthy gut? There could be different things, but I kind of like summarize it into the regular bowel movements. And regular doesn't mean that someone has to have a bowel movement every day, right? It's very personal, and it depends on the human being. Some people can have regular bowel movements every day, and that's normal. So other people can have every other day, every 3 days, or maybe 3 times a week, which is also normal, as long as you're having the formed stool, normal color, which is the dark brown or the brown, and then consistency needs to be not like the liquid and then not loose, kind of like a solid consistency, right? And then again, just because somebody has the bowel movements every day, and then other person has the bowel movements every 3 days, doesn't mean that any of those people have issues, right? Again, it's very personal and depends on the human being. Also, good sleep and mood, also signs of a good gut health, and then minimal bloating and a strong immune system.
What would you consider minimal bloating?
Yeah, so bloating happens a lot, and then we go through the little bit more details. Especially if you eat too fast, if it carbonated drinks, sugars, that can cause bloating. But it's usually transient and then gets better quickly. But when you have a bloating that's constant for like hours and then happens every day, that's when you kind of need to be more concerned and trying to see your primary care doctor first to discuss your bloating and the health issues.
Maybe would you treat yourself, like with baking soda and water?
So we'll go through that. We'll get there, and then we'll see some of the myths and then the facts. What are the myths and what's facts? Okay, so I'll respond to that a little later. Okay. What are the signs of gut imbalance? Constipation and diarrhea, especially if somebody was having the normal bowel movements, meaning maybe somebody was having bowel movements every day, it was solid, normal color. And then suddenly you notice that you're constipated, meaning you having bowel movements every week, once every week, and then it takes strain to empty your bowel, and then even after the sometimes people feel like not really fully empty the bowel, they still have the urge to defecate, right? So, and then diarrhea, right? You've been doing well, you had a normal bowel movements, and suddenly you're having diarrhea. These are all signs of something is wrong with your gut, and that's a way. It's when you kind of try to see somebody, ideally primary care doctor, to start with, and discuss your concerns. And frequent infections, as we said, our gut is protector. We eat a lot of bacteria with the food every day, but we don't really get sick because we have the gut which protects us. But if for some reason there's a gut disbalance, and if there's some bacteria that are not good bacteria, they can increase the chance of infections. People can have frequent diarrheas and etc. So why the gut health is important beyond digestion, right? So gut health also is closely linked to the brain health. We have a gut-brain axis, which we'll discuss a little in the next slide, actually. Immune system, as I told you, gut is our protector, starting from the stomach, the esophagus, and then the bowels. They are the barrier, and it's protecting us from the bacteria, outside bacteria. Also, the gut is very important to healthy gut is important to weigh your weight and the metabolism. If something happens, and you have a disruption in your gut health, that might lead to the weight gain, and then increase the chance of having hyperlipidemia, diabetes, and other chronic issues. And skin conditions as well. There's a lot of the skin conditions, even one of the most common skin conditions like eczema and acne, are linked to the unhealthy gut. Okay. Okay. Now let's discuss the gut-brain barrier. Sometimes there's the quote that trust your gut feeling. Right? Why is it so? Because our brain and gut is connected. And then we have the vagus nerve, which is the really long nerve coming from the brain, and then goes down to your body and supplies lots of the intestines and then the stomach. It goes through till the large intestine, and then again this nerve vagus coming from the brain. And there's a hormone called the serotonin, which I'm sure you had in the past, and this is the hormone that we call the good hormone, like the feeling good hormone, and then 90 to 95% of the hormone coming from the gut, which is kind of surprising, because even if you ask a lot of the doctors and the people outside, they'll probably tell you that it's coming from the brain, right? People who have anxiety, depression, sometimes they have a decreased level of serotonin. And people usually know that it's coming from the brain, but they don't know that 90% to 95% coming from the gut. And stress affects your gut, causes bloating, cramps, diarrhea, and poor gut health can worsen anxiety, depression, and fatigue. So how to support our gut and our brain? We'll go through this also in next slides, but one of the best things to do is eating fiber-rich food, staying active, manage your stress, and then sleep well. So now let's discuss what are some of the things that might hurt the healthy gut, right? So first thing is antibiotics. So very commonly used, we usually use antibiotics for bacterial infections, right? You should always, as a doctor, should always be very cautious not to prescribe antibiotics for the things that not meant to be like viral infections, because they have no role. But at the same time, these antibiotics can disrupt your normal good bacteria, and then when the good bacteria are killed, sometimes bad bacteria kind of take over, and then that's what causes sometimes diarrhea and then unhealthy gut. The processed food, like high in sugars, additives, and unhealthy fats, feed the bad bacteria again, and increases inflammation inside of the gut and then inside of the body. Chronic stress disrupts digestion and motility, linked to leaky bowel, which also lead to the inflammation. Poor sleep. Sleep is very, very important for a healthy gut. weakens immune system if you don't sleep well, and then alters gut bacterial balance even overnight. So it's very important to all of us to have a good 7 to 9 hour sleep.
What is cortisol?
So cortisol is a stress hormone that is coming from our glands called suprarenal glands. They're above the kidneys. And then cortisol also, increased cortisol level also leads to increased stress. And then increased stress, as we mentioned, sometimes lead to some of the common symptoms like bloating, indigestion, and then abdominal discomfort.
What about serotonin?
Serotonin is the feeling good hormone, which we all have and which we all need. And then, as we mentioned, serotonin coming mostly from the produced mostly from the gut. Okay, of course. And then the last one is sedentary lifestyle. Less movement equals slow digestion, and regular activity supports a healthier microbiome. In a hospital, people tend to get constipated because we see this a lot. Once the patients are admitted in the hospital, they obviously have some reasons, and then most of them kind of stay in the bed for days. They don't really ambulate much, and that's why they don't have regular exercise. So that's why they have a slowing down of the bowel, and then that leads to a constipation. That's why a lot of the patients in the hospital actually end up being on the laxatives, which are the medications, who helps us move the bowels. So that's why I want to stress that having the like exercise and then just even the moving after eating goes a long way and helps your bowel to activate. So now, what are some of the things that helps our gut health? Balanced diet. So we should really try to eat plenty of fibers, fruits, vegetables, and fermented foods. And we'll go through it like why all this the foods are like very beneficial for our gut health. And we should try to limit processed and then sugary items. Regular exercise, as I said, boosts the microbiome diversity and helps to have a regular bowel movements. Good sleep hygiene, aim for a 7 to 9 hour sleep. Give your bowel the time to rest and regenerate. And stress management, practice deep breathing, meditation, gentle movements. It lowers the gut inflammation, improves the digestion. Now, next slide is about the fibers, right? So I'm sure everyone heard before, fibers, they are so important for our health, right? So we always say, when we see the patients in either hospital or a North Hudson clinic, we always say, oh yeah, I should really try to eat more fibers, right? Then they are really good, but let's discuss and then kind of go into the little bit in details why are the fibers so good, right? So they improve motility, they help move food smoothly through the digestive system, prevents constipations, and support regularity. Feeds the healthy bacteria, right? That's what we want. We want our healthy bacteria to be strong, and then we want bad bacteria to be killed. So act as a prebiotic, foods for a good bacterial microbiome, encourages growth of the beneficial bacteria, as we said, good bacteria. And it reduces the inflammation, promotes production of the short chain fatty acids, which decrease the inflammation first locally in the gut, and also the travel to the blood and decrease the inflammation throughout the body. Now let's discuss what are some of the types of the fibers and then how to get those fibers, right? So we have soluble fibers and we have insoluble fibers. Soluble fibers dissolve into water, so they become liquid. They slow digestion, they lower cholesterol, and some of the sources to get soluble fibers are oats, apples, beans, citrus fruits, and the carrots. Regarding insoluble fibers, they are bigger, they are very bulky, and they does not dissolve in the water usually. They are the ones who promote regular bowel movement. How to get those insoluble fibers? You can try whole meat, brown rice, nuts, cauliflower, green beans. And the picture on the right side shows what are some of the best sources of the fibers. And you can see that lentils and then black beans, they have a 15 gram of the fiber, which are one of the most fiber-rich food out there. And as you say, the raspberries and oats and broccoli, they don't have that much, but they also have significant amount of the fibers. Okay, so now the next question is, how much fiber do we need every day, right? So most Americans only eat up to 15 grams of the fiber, which is less than optimal. Recommended dose of the fibers for a woman is 25 grams a day, and then for a man is 38 grams a day. So as we said, low fibers equals poor digestion. People tend to get constipated, and then people tend to get bad bacteria versus good bacteria. How to increase the fiber intake, right? Maybe this is something new that you heard, that fiber is really good. And when you go home, you kind of need to know how do you start taking the fibers, right? So the major and important thing is just to start it gradually, right? We don't want people to start taking fibers like 30 to 45 grams first day, right? Which also will cause bloating and indigestion. So add fiber gradually, increase 5 grams per week. Not per day, but per week. Drink plenty of water to help fibers move through. Because the fibers, again, sometimes, especially the insoluble fibers, they're very bulky. They tend to reabsorb the water from the body to the gut lumen. And then if you eat too much, they might reabsorb lots of water, and then you can have a diarrhea, and they can lead to dehydration. So hydration is very important while taking the fibers. And it's recommended to take mixed soluble and then insoluble fibers to kind of balance it out, and then avoid larger jumps. Again, you're not supposed to go home and from 0 to like 30 to 40 grams every day. Take it easy, take it slowly, and then your body will have time to adapt. Okay? Now let's discuss the prebiotics and probiotics, right? It's a common, the words I'm sure you've heard in the past, and then you probably ask your primary doctors, do I really need to take the probiotics, right? So let's try to answer that question today. So the prebiotics are a type of fiber that fits the good bacteria. So they don't contain bacteria itself, but they contain the fibers that are good for the bacterial growth. And then these bacteria are the ones that contribute to our healthy gut. They help the healthy microbiome grow and thrive. And how do they work? So how does this, maybe banana helps your bowel? So the prebiotics pass through the stomach without the digestion. So when they reach to the colon, which is the large bowel, which we have all the bacteria, they get fermented into short-chain fatty acids. And as we said a couple of slides before, short-chain fatty acids are very important to decrease the inflammation locally and then throughout your body. And these are the common the probiotic contained foods. And I'm sure a lot of you, hopefully, and a lot of us are eating this on a daily basis. Now discuss what are the probiotics. So the slide before was about prebiotics. Now what's a probiotics? So probiotics are live healthy bacteria. So you're basically eating some of the bacteria itself. What they do, why do we need to consume these probiotics? They restore the balance in our gut microbiome, support the digestion and nutrient absorption, and they may have a role in certain conditions like irritable bowel syndrome, diarrhea, and then just in general to increase the immunity of your body. Are they safe? They are generally safe. And then, again, we usually, a lot of us eat the foods even every day. So they don't usually have much of a side effects, but you really want to talk to your primary care doctor about the probiotics if you have serious immunocompromised conditions, which means you have a very weak immune system, or if you have like chronic conditions. I would really discuss with the doctor first before initiating the fiber intake. And on the right side, again, there's some of the food rich in probiotics. Okay, so the question is, should you take the probiotic supplements, right? So prebiotics and probiotics are just part of the food we eat, right? But the question is, do we need to take the supplement? Do we need to take the pill, which you can buy and take it, right? The answer is, it depends really if you want to try it, and it depends on the discretion of you and your doctor. So there's some of the conditions that probiotics can really help. They could be beneficial after a course of antibiotics, right? As we said, sometimes antibiotics destroy our good bacteria, and to take the probiotics sometimes could be beneficial. Some of the studies show that, probiotics with antibiotics decreases the post-antibiotic diarrhea, and then there's a condition called Helicobacter pylori, which is the bacteria lives in stomach, hopefully not our stomach. And then it's only bacteria that can survive in the stomach, and unfortunately sometimes it can cause stomach ulcers, the small bowel ulcers, and then in some cases they can also cause cancer. So it's very important. It's actually very relatively prevalent in our community in the North Hudson Clinic. And then there's a treatment. We usually use triple or quadruple therapy, which are the 2 or 3 antibiotics at the same time. You should take 10 to 14 days to get rid of the bacteria. So the study showed that sometimes, when you take all these antibiotics with the probiotics, probiotics helps to mitigate some of the side effects of the antibiotics. Sometimes people feel really nauseous. Sometimes people have some diarrhea, bloating. They don't really want to take the antibiotics, so they stop taking it, which can lead to the worst outcomes because that's not how you will kill the bacteria. So the study showed that if you take this the probiotic with antibiotics, there's a higher chance of you can actually finish the 14 to 10-day course of antibiotics, and outcomes meaning the eradication of the bacteria are high in the percentage.
Sometimes it's said to take a yogurt with an antibiotic. That's the same type of thing.
Correct. See, if you go in the back, so yogurt is a probiotic, right? So taking yogurt versus taking the pill would be kind of like same, because both of them will have the bacteria, the good bacteria that we need. So yes, taking yogurt or any other food here will act as a probiotic with antibiotics, and then ideally will help you to tolerate the antibiotics and decrease the chance of some of the complications, let's say diarrhea, which is a common side effect of the antibiotics. Okay. Yeah, so some other cases that probiotics could be beneficial is the patients with irritable bowel syndrome, digestive issues which can lead to the bloating and irregularity, and then probiotics sometimes can be helpful to manage your chronic gut inflammation. But the question is, and then these are some of the things that we need to consider. Supplements are not one size fits all. So it's not that you're going to take the one specific probiotics and it's going to be super helpful for you, and then it's going to be super helpful for everybody, right? So there's a different strains, different kinds of bacteria, the good bacteria, and then different bacteria can be used for different reasons. So that's why you really want to, if you want to take the supplement probiotic, you really want to talk to your doctor, and then hopefully they will help you to figure out what are the best type of probiotics you can take and to treat the gut condition. And then, as we said, if you have either immunocompromised, which means you have a weakened immune system, you're pregnant, people with the chronic, lots of chronic comorbidities, you really want to talk to your doctor first before taking any type of pill in general. And the last, sorry? You said yogurt? Yes. So as she mentioned, yogurt is also is a probiotic which contains some of the good bacteria that we need. So you can take yogurt and it will act as a probiotic. It will help you to restore your gut balance. Okay. And as we said, it's always better to take food, which is more natural way, versus taking the pill. So this is just true for generally for everything, right? If we have the ways to deal with just the natural way, with exercise, lifestyle modification, the healthy diet, we should always exhaust those options first before going to the medications. Now I would like to discuss some of the common gut issues that you might have heard. So first one is irritable bowel syndrome. It's very common. It's very, the symptoms of this in the condition is also very irritable, causing bloating, cramping, can cause diarrhea, can cause constipation. Some people can have kind of a little bit of a both. People have like days of constipation followed by days of diarrhea or vice versa. And then if it's sometimes worse with stress and then certain foods. So as we said before, stress and our brain health also is closely linked to our gut health. Next one is reflux. The whole name is gastroesophageal reflux disease, which is when you have a burning sensation in your chest. It's very common. So lifetime prevalence of the reflux in the USA, it's like 30 to 40%. That means every 3 of us at some point will have a symptoms of GERD. Extremely common. It's easy to treat in the early stages, and then treatment will be try to change some of your eating habits and the dietary modifications. The best thing to do is to avoid drinking too much coffee, too much chocolate. Spicy food also can worsen the reflux. And then one of the major changes also we tell the patients to make is that if you eat, let's say, lunch or a dinner, not just go down and then lay down and then sleep, because that will.
Eat what?
If you eat lunch or a dinner, lunch, just lunch, yeah, lunch or a dinner. So it's not recommended to go down and sleep immediately, because when you're like in a horizontal position, it's easier the stomach acid to go to the esophagus. So we always recommend people to stay active at least an hour or two, stay upright, maybe take a small walk. It will activate your bowel, and it will decrease the chance of the reflux. Okay, so that's some of the modifications you can try, and if those are not helpful, then we have some of the medications to decrease the acidity, which are usually very helpful. Next one is lactose intolerance. Also very common. Unfortunately, some people do not have the enzyme called lactase, which digests milk and the dairy products. Some people are born with it, so they don't have it from the beginning. Some people can eat cheese or the milk, but at some point in their life, they lose the enzyme and they become lactose intolerant. It's very simple to treat the condition. We always tell people to try to avoid the dairy products and the milk. If you really like your cheese, if you really want to have a milk, and if you really want to have an ice cream, you can buy the enzymes, lactase, and you can take the enzymes immediately when you start eating, and then hopefully enzyme will digest your lactose, and you don't develop diarrhea and then abdominal bloating. So that's also an option if you can't really stay away from the dairy products.
Just with the bloating, what about you burp a lot? Burping of gas?
Yeah, that's also that is also signs of like an unhealthy gut. Again, at some degree, we all have those. The gas formation in the bowel. But when it's excessive, it's like constant. It happens every day. It happens throughout the day. That's when you need to be concerned that something is wrong with the gut. But not every time you have you burping or you have a gas, it's not pathologic. Okay. And the last one is diverticulosis, which is the small pouches of the colon. So as we get older, lots of people will get diverticulosis. This is just the nature of the large bowel. And then some of us will never really find out that we had this issue, diverticulosis, right? So people usually who know they have an issue, that's when they get the complications like diverticulitis, which means usually people with constipation can have a stool or the bacteria causing inflammation of the diverticulum, and it causes inflammation, which can cause fever, abdominal pain, and that's when you need to see the doctor. And usually inpatient service, you can get antibiotics to treat it. Sometimes people can have diverticular bleeding, which is usually painless. The problem is that with the small pouches, they have a really thin wall, and then it's easy, especially people who are constipated, this thin wall to get damaged, and the blood vessel there will get damaged, and people tend to have the bloody bowel movement. This is also signs that you really want to go to the hospital and then have that checked out. And then the key to avoid all these complications is to stay hydrated, eat a lot of fibers, so hope to avoid the constipation, which is the #1 cause of the complications, constipation in these patients. Okay, so next one is belly fat, bloating, and gut health. So belly fat, it's not just the fat that we sometimes have, and just superficially under the skin, but this kind of visceral fat means the fat that's deep into the belly and it's around some of the organs, which could be very dangerous because fat around the organs can cause inflammation there and cause a damage of the organs. One of the really good example of this is a fatty liver, which is there's a fatty tissue depositions inside of the liver, which is reversible. With losing weight, with some medications, you can go back to the normal. But the fatty tissue there causes the inflammation because they tend to create the molecules that will produce the inflammation. And then with the inflammation, just a fatty liver can turn into the hepatitis, which is the inflammation of the liver. And if this happens chronically and for years, this can turn into the liver cirrhosis, which is the end stage disease of the liver. There's really no coming back, no going back once someone has a liver cirrhosis. And all these things have started from the fatty tissue in the liver. And then also having lots of belly fat is also linked to insulin resistance, which means you could have a high blood sugar with prediabetes, sometimes diabetes. It's linked to the cardiovascular events like heart attacks and high cholesterol level. And then what causes bloating, right? So there's different things that can cause bloating. Bloating is very common complaint in the patients with gastrointestinal issues. So it's too much or too little fibers, right? So as I said, fibers are very good, but if you eat too much, they can cause bloating. That's why it's recommended to kind of slowly go up on the fiber intake. The food intolerance, people with lactose intolerance, they tend to get bloated, they tend to have a lot of gas, and they tend to have a diarrhea. Gluten intolerance is when somebody consumes the gluten, which is kind of causes allergy, gluten allergy, which damages your small bowel, and damaged small bowel cannot really reabsorb the important nutrient, and people tend to have a malabsorption, which means they're not keeping some of the most important nutrients in the body, and they're having the diarrhea. Imbalance in gut bacteria. Dysbiosis meaning when the bad bacteria take over good bacteria, and eating too fast, eating carbonated drinks and artificial sweeteners. All this can cause bloating. But sometimes bloating can be also a sign of very serious gastrointestinal issues. The bloating all the time, heaviness in your abdomen, early satiety. There can be also signs of the stomach issues like stomach ulcers, even stomach cancer. So again, once you have these issues and if it's constant and it's bothering you, it's best way to go and see the doctor and check this out. Check it out. What helps, right? So one more time. Balance fiber intake. The mix of the soluble and insoluble fibers. Avoid trigger food. Probiotics and hydration. and slow mindful eating.
What's heartburn?
Heartburn is when you have this burning sensation in your chest, and then it's usually coming from the stomach. So when the stomach acid goes back to the esophagus, which is a tube between the mouth and the stomach, when the acid gets to the esophagus, it causes burning sensation. That's why we call it heartburn.
Similar to reflux?
Correct. That's reflux and heartburn are kind of like the same thing. It's not moving anymore. Hey, let me call her for help.
Doctor, what would you suggest?
Sorry?
What would you suggest on a natural note for people who have diverticulosis?
Diverticulosis?
Yes.
So best thing to avoid complications like diverticulitis, which is inflammation, or the diverticular bleeding, it's avoiding constipation. So eating lots of fiber, stay hydrated so you don't get constipated. Ideally, try to have a bowel movements every day, the soft bowel movements, which decreases the chance of some of the complications. Okay?
When you go to your GI and you have an endoscopy done,
Correct.
all right, that would probably indicate if you had any big issues like diverticulitis or diverticulosis, if you had, you speak about gut inflammation, and I'm not sure what would be indicative of that. Is that something that would also be seen if you were doing a scope, if you were doing your endoscopy?
Yes. So if you're doing, so usually it's a colonoscopy to see the large bowel,
Yes.
and then endoscopy is mostly to kind of check the esophagus and stomach and part of the small bowel, right?
Yeah, colonoscopy.
Yes. Yeah. So colonoscopy will definitely see if there's any diverticulum there because it's outpouching, and also you can tell the inflammation because there's visible changes, and also people when you don't like any area of the colon, people tend to get the biopsy, and then they will check the pathology results, and then even they can see in the molecular level, like a tissue level, if there's any inflammation. So unfortunately, not every inflammation will be detectable with the eyes. That's why, but gastroenterologists will take some of the sometimes random biopsies throughout the colon, and the pathologist would analyze it to make sure we are not missing any type of chronic inflammation, any part of the colon. Okay. But major things like any a type of mass, like benign or the malignant masses in the colon, or in the esophagus and stomach, it's usually detectable with colonoscopy and endoscopy. And any type of obvious inflammation, people with inflammatory bowel disease, with having bloody diarrhea and then lots of abdominal pain, that's also visible, detectable with the colonoscopy. But sometimes they can be subtle, and that's why having the biopsies helps to kind of see what the tissue look like, microscopic level. Okay. Sure.
In the colon also, sometimes there's polyps there. Is that something that's diverticulitis, or is that turning into? Is that two different things?
No, so that's completely different, right? So the polyps in the colon are very common, and then a lot of those will be totally benign, meaning will not really turn into the cancer. That's why nowadays, after 45 years, there's a recommendation to have the colonoscopy done, and then they will check the whole colon, and then if there's any the polyps, they usually remove it, and then they will analyze it to know is it malignant versus totally benign, the polyp, right? And then based on what it was, they will tell you to come back after 5 years, after 10 years versus after 1 year, depending on how dangerous was the polyp. But the polyps usually has nothing to do with the diverticulum. Okay. Okay. So stress in the gut, we kind of touch base on this, that how the stress can have a really big impact of the gut health. The stress triggers inflammation in the gut. As we mentioned, the cortisol is a stress hormone, which increases while people are stressed, and then it can cause the inflammation of the gut. Increases gut sensitivity, more pain, cramping, disrupts motility, diarrhea or constipation, can worsen inflammatory bowel syndrome, reflux, and bloating. Sometimes when the people are very nervous, especially like young people, before the important exams, they tend to get abdominal cramps, they tend to get diarrhea. This is usually because of the stress, and then brain and then the gut axis is disrupted, which tend to get better once they are relieved from the stress. So what are some of the gut-friendly stress relief tips? So deep breathing exercises. So there's a 4-7-8 breathing rule, which means take a deep breath through your nose for 4 seconds, and then hold your breath for 7 seconds, and then breathe out for 8 seconds. So slow breathe out 8 seconds. And you're supposed to repeat this 4 or 5 times, and then a couple of times a day if you need to, which will help you to decrease stress and then relieve some of the sensation of the bloating, and then maybe even the cramps. Go for a walk after meals. As I mentioned, the walking activates your bowel and then helps the food to move throughout the bowel. Practice mindfulness and meditation. Get 7 to 9 hours sleep. Again, give your body time to heal overnight, and then your gut. And spend time offline. Spend time with this is the great exercise to come here and then spend time with each other, not in front of the computers. So now let's discuss some of the myths versus the truth, right? So the fasting and then cleanses. So when I was second year resident, I was in the North Hudson Clinic, and then I had a patient. She was very nice. She asked me, when we finished everything, she asked me so if I would recommend for her to do the cleanses. And at that time, I was really not sure what was she the referring to. And when I asked her, she asked me if I would prescribe her medications to kind of have the bowel movement to kind of empty whole bowel, right? So let's figure out, these things really help, or this is a part of the myth, right? So what are the common myths? So the cleanses remove toxins from your gut. That's not true. The juice fasting resets your system. Also not true. And detox diet are necessary for gut health. But what is the truth? So we have a liver and we have a kidney, which are already functioning as a detox organs, right? So the function of the liver and kidney is to get rid of the waste products from the body. So we already have those, the functions done by the liver, so you don't have to take anything from the outside. Extreme fasting and liquid-only diet can disrupt gut microbiome. As we mentioned, if you don't eat this food that has the prebiotics and the probiotics, and if you just drink water, they will sometimes result into the disruption of the bacterial flora, that dysbiosis, which means sometimes the bad bacteria can take over the good bacteria. And cleanses often lacks fiber, proteins, and key nutrients. And then we spend 40 minutes for now discussing how fibers are very important for our gut health. What are some of the better alternatives? Eat whole plant-rich foods, stay hydrated, and then give your gut time to regenerate and heal. You can eat dinner at 6, 7, and then go to sleep early, and that's your 12-hour fasting overnight. And the last slide for today, movement and your microbiome. So we also kind of touch base on that. I wanted to give you a little bit more details. So exercise, we all know how good is the exercise, right? Every patient we'll see in the clinic, in the hospital, we always say, exercise is really good to control your sugar, control your blood pressure. It's good for the high cholesterol level. But it's not just these chronic issues that we can avoid with exercise, but also it helps our gut, and it helps to maintain the healthy gut. So just 20 to 30 minutes of the physical exercise can increase the diversity of our bacterial microbiome, reduces inflammation, improves motility, and they reduce bloating, and supports immunity. So it's just not food, right? We spend time saying that how good is this probiotics and prebiotics, how important is the fibers, but it's not just food. Also, physical exercise is important to keep your gut healthy. And what are some of the gut-friendly movement ideas? Take a brisk walk after meals, yoga and stretching, dancing, biking, swimming. I would not recommend dancing immediately after meals. Give it some time to settle, and you can try that after. And then gardening or light chores also can be helpful. Okay. And then thank you all. I will answer your questions if you have one. Sure.
Lately, we've been taking some other classes here at the center about the benefits of tea, drinking tea, green tea, and all those kinds of tea. What's your position on tea for the gut?
Yeah, I think as we go through the slides, I don't think tea was necessarily affecting positively or negatively the bowel. The tea always contains the caffeine, and even the coffee, right? When you have a tea or coffee, it kind of activates, also caffeine activates your bowel and helps you to have a bowel movement, which could be the positive. And then drinking the tea means, you're drinking the fluids, so you're getting hydrated. So it's probably nothing but the positives. Yes?
My apologies, I was late.
Of course, it's okay.
I wanted to know, I'm sure we covered this, but I wanted to know, what's the difference between probiotics and prebiotics?
Yes.
Like, which one do we use?
So yeah, we can touch base on it. I can just go back for you and then quickly take a look. So the major difference that we had was that the prebiotics are just the fiber, dietary fiber, that will help your good bacteria to get better and then to multiply. So basically, it's a fuel for the good bacteria, right? And then these are some of the prebiotic-rich food. And versus probiotics, meaning that you're already eating the live bacteria, which is the good bacteria. It's not a food, but it's already eating the good bacteria, which also do the same thing. It will help your gut flora, your good bacteria, to have a healthy environment to multiply, and then it will try to balance your gut. So I would say both of them can be beneficial. Both of them have the same end goal to help your balancing the gut health and then gut bacteria, the good bacteria. So I mean, depending on what do you like to eat more, is it like banana versus yogurt? Both of them will have basically the same effects on your body. Okay.
You tend to eat more probiotics than prebiotics. Would that tend to cause more constipation?
Sorry?
If you tend to eat more of a probiotic diet, would that cause more
I don't think.
constipation?
Yeah, that's a really good question. I don't think, as far as I know, I don't have any information that any of those are connected to the constipation versus diarrhea. I think again the main thing is just restoring your the good bacteria flora in your bowel, which will probably kind of help you to balance your bowel movement. So I don't necessarily think that it would result into constipation versus diarrhea.
And what are some of the cheeses that have the probiotics?
I think I'm not sure exactly what type of cheese is it. I'm pretty sure most of the wool cheese, especially the cheese that needs to be fermented, require the fermentation, will have a lot of probiotics. Sure.
So, is the timing of your meals help, not help, like with bloating versus not, or just overall gut health in terms of maybe what you're eating, and whether it's
what time?
portions here tend to be quite large as opposed to something that's quite smaller.
Exactly.
So just trying to understand a little bit more of that.
Yeah. So that's a great question. So ideally, we tell patients to eat frequent and small meals. It's easier our body to digest the small portions versus eating one time, like one huge meal, getting lots of carbonated drinks, which will obviously cause the distension of your stomach and discomfort, and will result into the more bloating. So my recommendation, and the recommendation in general, is eat the small but frequent meals, and then people tend to skip the breakfast. If you are the breakfast person, it's good to have a breakfast. They can kind of have the same routine, eat kind of like around the same time as you always do. Have the good the hygiene, what you eat and how you eat, and then the main recommendation is not to eat too late, and especially not just eat something very heavy and go to sleep, because that's what leads to the indigestion, gas formation, and the bloating. Okay.
Recommend you stay alive for 1 more hour.
Correct. At least upright. So at least, even if you don't like the walk around, at least sit on the couch, watch something. Don't just lay down, and it will decrease the chance of having the reflux.
You also recommend we not drink a lot of water right after eating.
So that's also, I think that's also a myth, the kind of like a common myth. I think I would say that you can drink water throughout the day just to stay hydrated. Not necessarily I would drink like a lot of water after a meal, because again, everything goes to the stomach, and you don't want to like distend your stomach and cause discomfort. But you can drink the water throughout the day, and I would drink like regular amount of water as you feel like drinking during the dinner as well, and after meals. Nothing like specifically like, oh, let's just drink like a liter of water immediately. I don't know the exact answer to that. I don't think so. Again, we drink water throughout the day. Doesn't really dilute the acid. We still function normally. So I don't think so. I would not really drink lots of water with the meals, because again, everything goes to the stomach. The stomach only has some the space there. If you drink like too much water, you have too much food there, can cause distension of the stomach and cause discomfort. Okay, of course.
Eating animal proteins over eating a plant-based diet and digestion. It should be early in the morning, should be midday, if you're going to have animal proteins, take them over.
Yeah. I don't think there's like different timing when to eat which. They just it's nature. They are different in nature, animal versus the plant-based proteins. I mean, proteins are very useful and a very good type of the nutrient that we should be eating. And then as long as you are getting the good amount of protein from the plants or for the animals, that's still fine. And there's really no timing when you want to eat like more protein versus less protein. I think again, the part of the balanced diet is try to eat a little bit of the sugars, a little bit of meat, the fats, a little bit of protein, and the vegetables with it, to kind of balance everything what you eat.
Alrighty, let's give it up for that.
Okay. Thank you guys for meeting.